Hi, my name is Shahid Shah, and I am the chairman of the Health Impact Forum, which is a series of healthcare information technology, or Health IT, a series of events that we hold in various parts of the country during the year. I'm often asked why, as a healthcare IT blogger, I would want to lead an event like Health Impact, and the simple answer is that I want to focus on events that are very relevant, very practical, and perhaps more than anything else, very actionable. I get a sense that these days we're getting sick and tired of hearing that healthcare technology is important. I think everybody understands that healthcare technology is important. The question is, what do we all do about it? It's not that interesting to say that IT is changing the world and it's going to change healthcare. It's not that interesting to hear that the consumer world has Facebook and healthcare is behind the times. What is very important to hear, though, is how do we not talk down to people and really give them sound technology advice that is very, very important to the daily work that they're doing? Again, practical, relevant, and actionable. Because we all know that health IT is important, it's more important to know not why it's important, but how do we apply it in a way that doesn't harm the organizations that we're trying to put it into, that doesn't alienate the patients that we're trying to serve, and perhaps overall, just making sure we do it in a way that doesn't make us lose money in the process of implementing technology. So what I'd like to cover at these kind of events is what you need to know and what you need to focus on as far as technology is concerned. Not that tech is important, but why it's important in a particular set of use cases that you need to be very, very worried about. We want to focus on the myths around technology implementation. We want to focus on the bad advice that people give often in technology environments. What you need to know what to do, not as a best practice per se, but as good practices and standard practices and things that you can apply. There is no one way to do technology, and there's no one way to make it all work. So we hear all the time that there are very, very important things like patient engagement and care collaboration and information like meaningful use, ICD-10, but really, which ones are important to your organizations? Why they're important to your organizations in a way that you can apply them to your organization, and doing so in a way that doesn't alienate your patients and your staff and your employees is crucial. So what I'm hoping to come out of our series of Health Impact events are practical, relevant, actionable pieces of intelligence that you could take at the end of the day and really apply them to your daily work the next day.